Hello, everyone. Welcome, welcome, welcome. As you are arriving, it is so good. So good to be with you here. Look forward to each time we get together, and today is a really awesome special session. So as people are arriving, I'd like to go over some of the technical things just to give a few last minute stragglers the opportunity to come on in. And for those of you who are here, I'd like to introduce you to how we'll be using the technology of our session today. So I'm sure at this point, many of you are far more than familiar with how Zoom works, but we will confirm. We often get the question, can we see you? We can't. We are in one of those formats that you will get to see us today, but we won't see you unless you opt when we ask to come on screen. So you're in the privacy of your own space. So if we do any exercises or anything like that, please join in, indulge, and even better, we'd like you to engage and participate and jump on screen with us and ask questions. So there are ways to do that. And I'll bring your attention now to the bottom of your screen, or if you're on a phone, it's often at the bottom of your square. There should be a button that says reactions or raise hand. I'm going to use that reactions feature right now as a way to get to know you and to find out who's here and to let you get to use that technology with us. So if you, joining us today, are currently a student in one of our programs, if you are studying with Somatic Experiencing International, we'd love to know who you are. You're part of the community. We want to support you. Would you please hit the raise hand and raise your little hand, and we will get to see how many of you are currently students. By the way, I recently completed all my training, and so I'm with you on how thrilling, exciting, and awesome and intense that is. Okay, I'm seeing a couple of hands starting to raise. So far, it looks like about 10% of you are students. I love this part. It makes me do math. Maybe like 20%. Any other students among us, please hit the raise hand feature on your screen where it says reactions, or I think you can click on the little dots next to your own image, your own square, and I think that should give you an access to raise hand. Okay. All right, so I see you guys right on. Hi, Leela, Candace, Karen, Tanya, Vincent, Samantha. So glad to have students here with us. All right, we're going to go ahead and lower all those hands right now. And if you are, doing it again, if you are currently a practicing somatic experiencing practitioner, if you are trained in the modality somatic experiencing and a practitioner, please raise your hand so we can know how many of you are out there paving the way for all this work. Oh, and there's some names I see. Hi, Kara. Nice to see you. Yes. Cindy, Liz, Catherine, Celeste, right on. Okay, so it looks like, again, I'm getting about 10% of you, again, are, or no, I guess that's not 10, that's 20. Woo! Go math. About 20% of us are SCPs here. We call them SCPs if you're trained in somatic experiencing and practicing from it. All right, we will lower your hands now. As people are still arriving, we're seeing more numbers. Now, if you are none of those, if you're not an SE student or an SCP, please raise your hand. If you've come here for some other reason and you're just learning about the modality or the topic, wow, that's lighting up fast. Okay, it's almost 50% of you so far. Yeah, now, great. That's awesome. Thank you for, hi, Carrie and Jessica, Hope. Oh, I love the name Hope. Amy, Hayden, Emily. Okay, cool. Glad to have you all here. More than half of you. Wow, even like 60% of you now. Test on my math. Love it. We're going to lower all your hands. Cool. So now you're familiar with that feature. If you raise your hand during the session, we won't be taking raised hands, okay? But there will be points where we'll say, hey, so-and-so, if you've asked a question, would you be willing to come on screen and ask it? say, if yes, please raise that little hand so we know we have your verification. To in Zoom language, it's come from the attendee side to the panelist side, but we're kind of looking at everybody as guests today and featured guests. So sorry for that language. So if you are invited to come on screen at some point, we'll ask you to raise that hand so we know it's okay. Now, how would we know that you're someone who wants to come on screen? The next technical thing to look at is at the bottom of your screen, nearby that reactions button, you should see something that says Q&A. Now, the chat feature is essentially disabled. In our time together, we're not going to be utilizing that feature, but we will be using the Q&A. I may sometimes say chat, and that's always what I mean. So in the Q&A, I really want to invite you to go ahead and get familiar with what's in that. First of all, there's someone in our session with you on this attending guest side, and that's going to be Rabia Sheikh. She is there. Kind of, if you ask questions, there she just said, as the international support. She'll be giving links to books that are mentioned or anything like that that might come up, and she's just really supporting you in there. But to get to know everyone here, why don't you jump in there right now and put your name and the location you might be chiming in for. If you want to say anything about your profession or let us get to know you, that would be really cool. But that's the place to just kind of introduce yourself to the group. So if you, I don't see any popping up yet. So sometimes this is our tech checkout time. Yeah, okay, there we go. Hi, Holly. All right, so go ahead and just start putting in there a little bit about your name and where you're from. Other people can start to see you and get to know you. And that's really important to us because I'd like to introduce myself and welcome you today officially to our September SE Community Conversations. My name is Ami Lee, and I am the Director of Public Health for the organization that is committed to making a difference for trauma healing in the world. That said, we've created this series for you as something other than a webinar to just learn about content. We've created this series as a way to engage and gather and converse as best as we can across the miles, around the globe, to be connected. As we're connected around these topics, we choose kind of difficult and contemporary topics in public health concerns to get into dialogue about. We know that the connection itself begins to reveal something important about the subject. Today's subject is dealing with the complexities of grief, loss, palliative care, end of life, terminal illnesses, the kinds of things that happen in the treatment and the service of that conversation are intense. Your engagement, your inquiry, your participation is part of what serves the conversation. So at any point in the dialogue, I welcome you to put a question in the chat. If you're on Facebook, we're Facebooking live. Get that registration link and come on onto the Zoom side so we can answer your questions. So that said, welcome everybody who is here with us today. We have got Hope. Hi, Hope. I already highlighted your names. I love it so much. From LSW from the Jefferson Center. We've got Myrna in Canada. Welcome. Oh, Myrna, you're close. I love it. Kayla in Montana. Hayden. We got Philadelphia, Brazil. Welcome, Lulu. I love it from Brazil. Wow, Candace in South Africa. This always blows me away. I've done some of those weird fake Facebooky things where you see the locations, but this is live right now. This is no joke. This is where people are at who are with us. So sensing into yourself right now, the world with South Africa, Portland. Wow, a death doula from Portland. Wow, Tanya. We have Colorado, a couple of Colorados, California, London. Liz, our hearts are with you all right now. And Jacksonville, cool, that's close to me. I'm so happy. Okay, more Toronto. I just can't, Montreal, I can't help but call it out. This just always blows me away. Welcome, everybody. Welcome. With no further ado, now that we've given you all the specs for the program, we've gotten you acquainted. Let's get you acquainted with our featured guests of today. If Jen and Renee and Anne and Ron could come on screen and come off mute, let's get to know you. Hi, guys. So neat to be with you. Good to see your faces and be in your spaces. Whoa, that rhymes. Started off goofy. There we go. We always set up the context of these conversations that it's like not a pressure to teach, but rather as if we got to engage outside of a classroom and realize we worked in similar fields and to have a conversation about that. Thank you so much for participating in that conversation. Grief, death, and dying and loss have been really significant in my life. It's an intensely personal topic. And I can recall that for the first 5 years after losing my brother as a young adult, doing lots of therapy and like begging therapists to help and feeling like it couldn't get the support it needed. The grief had its own life and it was living my life. Then I found a somatic therapist. And oh my goodness, the world shifted. I arrived back in me and I got to be with what was there to do the work on. So when I knew that you each work in that field in some way, I was touched and moved personally by your bravery and your fields. And everybody else, I know you want me to shut up right now because these guys have amazing things to share. I'm going to let them introduce themselves by answering a question. You each have a different level of formal relationship to palliative care. Some identify as palliative, some not. But you all work in the field of grief and loss and support people there. I'm curious around that bravery and that commitment. And so if you could introduce yourself, please, by answering the question, what is it that draws you to this particular field? What informed you, drew you, called you? And if you could share your name, a little bit about your profession and where you are, and let the conversation begin. Thank you.
I'm Dr. Ronald Alexandra, and I practice somatic experiencing in Santa Monica, California. And I first became interested in somatics in 1970 when I met Dr. Alexander Lowen, who was the founder of bioenergetics. And then a couple of years later, I had the unique opportunity as a young intern to work at the Maryland Psychiatric Research Center with Dr. Stanislav Grof and Roshi Joan Halifax. And they had a project on applying the use of psychedelics to death and dying. And in the early 70s, I also became very interested in a serious student and became ordained as a lay Zen Buddhist. And there was a great deal of interest in Amherst, Massachusetts at that time, where people would reach out to those of us who were affiliated with the Zen Center to assist people, assist patients who were in the process of dying and needed preparation and guidance from a meditation, a spiritual, a transpersonal perspective. And then over the course of the last 4 decades in my private practice, when my patients or my students from various universities or their family members are in the process of needing preparation to make their exit, I've oftentimes been called in to both work in the clinical setting with people in preparation for death and dying, and then many, many times to be invited to more intimate hospital and or family home deaths to sit with and to guide and to counsel the being who's in preparation to their final exit. And so I bring a spiritual and transpersonal approach and merge that and unify it with the somatic experiencing approach. And I met Peter Levine in 1994. And then just in the last 5 years, Peter said to me, Ron, have you taken the training? And I said, no. And he said, oh, I think you should take the training. And so about 5 years ago, I took the training and was just thrilled and immensely touched and learned an extraordinary amount from the somatic experience.
Thank you, Ronald. Hi, I'm Renee. How I got into working in the fields of grief and palliative care, it's personal to me. I had lost a brother at a young age, and it was one of those moments where I feel like my whole career changed and shifted more toward working in public health and on a broader scale with various public health initiatives, to wanting to really work with individuals around grief. And I started working for hospice. I became a grief counselor, started realizing there's not a lot of options for children, and developed a program and protocol for working with children within the hospice that I worked. And within that space, realized there's a lot that's missing from just counseling in general that really allows for playfulness and curiosity and joy. And that working with kids really opened up something for me that I could utilize and translate into working with adults. So when I left hospice, I started working more in hospitals and then oncology, and ended up working, now I'm working as part of the palliative care team at Mayo Clinic. And and a lot of the work I do is around mindfulness, various somatic interventions, yoga. I was trained in yoga as well. So trying to incorporate all of these modalities into working with inpatient and outpatient patients. So I do bedside guided meditations and do a lot of teaching to family members as well, which I love. Just combining all of the skills and knowledge and helping people connect with themselves in a different way before they die has been really important to me. So, and I'm happy to be here and just share anything I can and learn from all of you.
Thank you. Thanks, Renee. I'm Ann Kellerman, and I first got started or interested in this work similar to Renee. I had a significant loss. My father died when I was in my early 20s, and I was sort of lost for a number of years trying to figure out what I wanted to do. And I ended up becoming a hospice volunteer, and I really just loved that work, which then led into my social work career in palliative care. And I'm currently a palliative care social worker in Washington, DC. I also am an SE student, and I got interested in SE because over the years in working in a hospital setting and an acute care setting, you know, so much of medicine is intellectualized, and families and patients are often having emotional responses, and we tend to want to answer those intellectually. And I got really interested in somatic work through a couple of colleagues who were interested in that and who were going into private practice and going through the training, and really became more interested in how to bring a lot of those techniques to the acute care setting and to the bedside for the families and the patients that we care for who are experiencing and going through serious illness and grief and loss. And I also just recently started doing some private practice work, and the practice that I have joined is focused on grief, loss, and illness. So.
Hi, everybody. I'm Jen Hackler here in Silver Spring. Very nervous, but we'll just see what comes out. I had no intention of working in the field of grief. In fact, my first year of grad school, I remember walking through the bookstore when there were books. I don't know if there's still books or not, but I was walking through the bookstore and I looked to the right and there was the whole grief and loss and Elizabeth Kubler-Ross and big books, you know. And I distinctly remember doing this. It's got nothing to do with me, you know. And so after grad school, someone suggested I apply for a job at the Wendt Center for Loss and Healing, and spent 2 years working with mothers and children living with AIDS, doing permanency planning. And then that grant ended, and a colleague said, "Well, why don't you work doing this new thing at the morgue?" I'm like, "The morgue? I don't know nothing about the morgue." And so there were, it was a new program, and we ended up doing it for 18 years. And my role, along with my colleagues, was every day of the year, one of us would be at the DC Medical Examiner's office to accompany families through the identification process. And it was really powerful, and it was exquisite. It was painful. It was kind of funny sometimes. And I began to see that my role was, as Kathy Kain says, just to be good company, you know, and to make something that's very difficult just a little bit easier. And there was a point, probably 7 years into the work, I was walking down the hall one morning at the morgue, and I thought, geez, oh, this does have something to do with my life. But it was so out of my awareness. And that was that I was born into a family where my dad's first wife died in labor with the sixth child. So the baby died and she died. And my mom adopted those 5 children and then had 2 more. And I was the second of those. I'm the youngest of 7. And in the family, there were no pictures of her. Her name was Norette. There were no stories. When her name did come up, it was like so, oh my God, felt terrible. And then I began to look at my work at the morgue, like sitting with people saying it did happen. It is really hard, and that it is good to talk about it. It's in fact good to have a picture. And one last thing, the more I worked at the morgue, my dad, who never talked about the baby or his first wife, he began to tell me little stories about her, and I began to realize that he's coming to life. Norette is coming to life as I'm sitting with families as they're getting ready to bury somebody. So that's how I got into that work. And then the SE work, I read Peter's book, and I just had to sign up. And that was in 2008, and I've been assisting a lot, and it's just great. So that's all for me.
So I know I know for me, it feels like sometimes I'm the only one that does this in my organization, or that kind of does this. And I'm just curious for you all, if you feel sometimes that you're unique in what you do in the field that you're working in, and how you deal with that, or how to get support around that.
Well, I don't experience myself as unique, but I do experience myself being affiliated with UCLA, and having been in Los Angeles for 4 decades, and having given a lot of talks on the relationship of spirituality. And my first book is Wise Mind, Open Mind, Finding Purpose and Meaning in Times of Crisis, Loss, and Change, is being a resource where people who are really in pain and they're suffering in preparation for dying, and being able to be a beacon or a sense of comfort or a light, to be able to hold out and to act in a way that provides a different spiritual perspective about what is actually happening or occurring in the death and dying process.
Mm-hmm.
Which I could say more of, but I want to make space for everyone.
I think, Renee, sometimes I feel like that, especially in the acute care side. If I'm in, more of our clinic setting, it might be a little different, but in the inpatient side, I often think of just the lack of touch, and touch is so medicalized. And so even just being like, not just, but somebody that can come in the room to hold somebody's hand, or even I think often of just so much of the overstimulation that happens with the noise that's in the hospital, and people being confused of where they are, doing some of those like grounding and resourcing. But sometimes it feels overwhelming at times, because there's so much care and there's so much need. I don't know if that's similar to your experience in the hospital.
Yeah, it's so true. It's just being able to help people, and even the staff, help learn more about their own nervous system and how to help patients create some kind of settling among everyone in the room, right? And I know I've done some education with my team, the team I work with, and they've been really good about modeling that and going in and kind of matching the energy of the room and, changing their breath and changing their presence in order to help other people feel a sense of calm. But there's so much going on in the hospital. Anyone who, especially in the ICU, if someone's in the ICU, it's just, there's so much activation constantly.
Yeah.
Beeps going off, alarms going off, IVs going off. So it can be challenging to even do the work in the hospital, but it's so important.
Yeah.
Just helping patients with breathing and touch and noticing things. And yeah.
And I'm glad, we're talking about the importance of grounding and touch and breathing. Because in the early 70s, when I would go to Cedars-Sinai Hospital in Good Samaritan Hospital to be present for someone's death, there was a lot of formality, and you weren't supposed to sit close to the patient when they're laying in bed. Touch was totally and completely prohibited. And more recently, I've noticed a wonderful and very sweet and compassionately loving shift among the nurses who come in. There is a lot of touching, holding of the wrists. Even some of the nurses I've observed start to talk to the patient about the importance of breathing, and there's not a lot to be afraid of. And so I think we've seen in the culture around death and dying a wonderful and terrific shift from a more sterile and medically distant connection to patients to a much more loving and kind, more compassionate approach. And about 4 years ago, I happened to be present at someone's death. And after the person took their last breath, the doctor that was in attendance did a blessing and actually went into a Tibetan Buddhist chant. And there was total acceptance in the room. The chant was Gate, Gate, Paragate, Bodhisattva, gone, gone, gone beyond, gone now, this soul, this being to the great shore. And most of the family and the nurses, as well as the doctor, everybody just spontaneously closed their eyes. There was not even a formal invocation to, okay, now we're going to meditate. There was this silent reverie and sense of deep stillness and a presence. And I just felt my heart, really open. And I was delighted that, wow, we've come so far now towards a more compassionate and more kind and gentler approach to assisting people in their exit. And I think it's also very important, as Anne said, the touching, to really reassure people from a somatic experiencing perspective that we're there, we're present, a hand on the shoulder, a hand on the wrist, and to facilitate the process of breathing so that the level of anxiety can be lowered and the temperature of the anxiety can be less. And so then it creates an opening also touch so that people can talk about what they're afraid of around the dying process. Again, in a much more compassionate and more open way.
Yeah, that's a really good point. I don't know if any of you noticed, though, during COVID, one of the things that I had to learn how to do was touch without touching, right? And really being able to be present in a way that they felt me comforting them, that in a way that might resemble touch, but it's not actual physical contact. In some ways that I would do that was kind of going back to some of the shamanic practices that I used to do when I did some shamanic healing work. And that's just kind of be in the space and just allow myself and really check in with myself. Where's my body? What's happening within me right now? How am I breathing? in order to help them have a shift in their own system. But COVID changed things dramatically for all of us. And it's such as something worth mentioning that it was just in doing, I don't do as much touch because I work in a hospital, but I do some. And I think just to check in with you all to see if that was present for you as well.
I think my experience during COVID is that our palliative care service, we work in a level 1 trauma center in DC, and we were just so busy. And so we were seeing COVID patients. And so I think my experience was continuing touch, but it was also, you sort of had all of this gear on, like this extra, PPE, and you were masked and not able to use really a soft voice because a lot of times people couldn't hear. So that was an adjustment of not wanting to sound like you were shouting at somebody, but trying to be present. And so it was this mix of, I did use some physical touch just to reassure people and also acknowledge the fact that, I'm sorry that I have to wear all of this. It must feel, so isolating to be here alone. At that time we weren't allowing visitors. So, and the staff was all, working long hours and traumatized in a lot of ways themselves. And so making sure that, like how my energy was and coming into that space, I think was different than on a normal, day working in an ICU.
Hi, guys.
Hi.
I'm just already moved and touched hearing you as somatic practitioners in this field and thinking about how about half of our guests today are, they're not SCPs, they're not trained in your field, and folks who are there, none of this is intended to be a commercial about Somatic Experiencing International. We are a charitable nonprofit, and we really just want to create resources around this conversation. But I can't, not listening to you, not name that most people, when they think of grief care of any kind, think about, how do I talk about the story? How am I going to talk to a therapist? I don't know what to say. There's a lot there in the talk, or and some people are extraordinary with being with silence. And I think that's often the kind of common discourse around loss. But you all are already, you're saying shamanic, you're far out there. You're in other worlds right now. You're talking about touch. I mean, this is not things, you're licensed clinical social workers. And how does what you understand as a somatically trained clinical person inform your work? Because you already sound really different than an average therapist might sound dealing with grief. Like why touch at all?
Well, from my perspective, I believe that there's a tremendous healing quality that gets exchanged in the healing quality of touch. And from a somatic experiencing perspective, as we all know, that there's a great deal of comfort and a great deal of support and a great deal of mutuality and mutual interconnectedness that takes place when we touch. And I think it was Anne, correct me if I'm wrong, but the thing about because of telehealth in the pandemic is, we haven't been able to be present face to face with a lot of our clients and patients. And one of the methods that I've just brought in is the use of archetype, of bringing in and calling in ancestral qualities of archetypes, like your grandmother or someone very close in the family tree, or invoking the wise woman or the wise priestess, to facilitate so that the being can feel a sense of being touched, being held. Can you visualize what it's like as if your grandmother was present with you right now, and you sat in her lap, or she came and sat by the hospital bed with you and held one or both of your hands. And so I think there are ways that we can transcend and pierce some of the stillness that one can experience when we're trying to work with somebody on Zoom, where we can access other avenues to bring in and to manifest that sense of what it would be like to really touch and be touched.
I have a story that I'd like to share that really speaks to touch and disconnection from ourselves and the support from the others after a death. And I've got permission to speak to this. One of my clients came in one day agitated, and she wasn't typically going to be agitated. And she shared that the night before, she and her husband had a little argument, which was unusual. And so she comes in to sit with me, and something was different. Just the energy was different. And so I asked what was going on, and they were in bed and they were snuggling, and he pulled her close, and she put her ear on his chest, and then got very upset and had no idea why she was upset. And then they had a little tension around it. And so with the SE work, what I knew was something was happening, that she had such a reaction, and it had something to do with that experience, and I had no idea what. And so in working with her little by little by little, what we began to find, what emerged, what came up was she had a look about her, and then tears, and then she had a thought, and then she shared, I'm going to get not upset, but she shared that she was driving a car, and there was an accident, and her daughter was killed, and her daughter was in the front seat. And what arose as she was working with me this particular morning was that she remembered something she hadn't remembered before, and that was that she looked at her daughter and knew something was terribly wrong, and she went to reach to touch her chest, and she didn't hear a heartbeat. And that was 10 years before this particular incident, the night before, with her husband. And what she connected was that putting her head on her husband's chest and hearing his heartbeat was too painful, because in the touch of not hearing her daughter's heartbeat. And so we kind of worked with it, and she realized that something that was so sweet and supportive, and being in his good care, in the comfort with her, they used to love to do that, and they hadn't done it for 10 years. And she had no awareness that they had not done that for 10 years. And it was so helpful just to kind of to work the edge of that charge, to realize, oh, I can't bear to hear his heartbeat because I didn't hear her heartbeat, And so what began to happen little by little, how did we work with it? We started by feeling the dog's heartbeat, a little titration. And then slowly, she would put her hand on his heart. And then at some point they could, it took a couple months. At some point they could then, have a sweet snuggle with her ear on his chest, which they loved. So that's how, the SE work, grief, connection, support, disconnection from shows up in my work now. So even though I don't work with palliative care, and I'm not in a hospital, God bless you guys. But that's how it showed that SE work shows up in my office.
I'm building on that in terms of, again, touch. I had a referral, and it was a couple, and they were articulated to me as a Catholic couple struggling with the loss of their 4 children in a car accident one evening, and that they had been working in another setting for about 6 to 9 months, and that the husband had become fairly mute. He stopped talking ever since the accident. And So they were referred to me, and I was doing the intake and sitting with them. And then I just closed my eyes, because I oftentimes like to receive guidance and instruction, because I actually said, oh my God, the loss of 4 children, what am I going to do with this? I mean, like, it really questioned my own ability or capacity to bring forth anything. And so I closed my eyes and I just had the image of a little circle of counsel. And so I suggested that we move off the couch and the chairs and sit on the floor and just have our knees touch. And then I asked the husband specifically if he'd be willing to hold hands with myself and his wife, and for us to just sit quietly. And there was no need to talk about the grief or the loss. There was no need to do anything except for us to just be present. And then I just suggested to, if you could, evoke just the image of each of the children's souls, and bring them into the circle. And then just with a light touching each time that the mom would say the name of a child, I would squeeze the hands and he would squeeze back. Then after 5 or 10 minutes, like a ripe peach, he just spontaneously broke into grieving and sobbing and wailing. And I think what the useful takeaway to unpack from that was moving from the verbal, the talking modality of trying to address such profound loss, but bringing in the somatic healing component of just simple touch. And that's all that we really did. And there was this huge release in opening. And so I think we have to pay homage to the power of touch in healing, touch in somatic work.
Thank you all. It's really beautiful. You're just helping us get more of a landscape. You know, each of those stories are so personal. And this work is personal, even if you're a caregiver in this. I'm sure you've, just like you were saying, Jen, Renee, and even just in the hospital cover stuff, you're all in grief too. If we're in life, we're in it. Hayden, who is with us, has a question, who's currently working through something in her family, and has said that they'd be willing to come on screen. And so are you guys up for us going and bringing someone over to explore what they're dealing with a little bit with you? Okay, Hayden, we're going to bring you on now. It gets a little weird on your side for a moment. I'm also thinking, with regards to somatics, like, I just welcome you. If anything comes up of something you could share with us, of just an exercise someone could do at some point, I welcome you guys to do that. But for now, Hayden, go ahead and unmute, dear human. Go ahead and share what so our guests have not seen what you wrote in there. So go ahead and share whatever is there for you, your question.
Yeah, thank you. I have attended today because this workshop spoke to me and some of the stuff I'm going through. I'm a massage therapist and I have a practice in North Carolina. I moved here about 2.5 years ago to start this work, and my family's back home in Texas. My dad has been living with mental health issues his entire life and Parkinson's for the past 15 years. And we only really discovered that was his condition about, 8 years ago. And he's since had some surgeries to help with controlling the condition. But where he's at now is some advancements in his dementia that has come in conjunction with all of this other stuff. And he reached out to me this past summer to tell me that he's needing to move into palliative care of some sort and trying to navigate that. And what it really felt like to me was, he has other family members there around him, but he just needed some help in navigating this from me and our connections. So currently, like me and my family, we're trying to organize around getting him in home care, and it's just like it is pretty tense among us. And I've started flying down to Texas about every 2 months to see my dad and to share what I've learned through my training as a massage and bodywork practitioner with my dad. And being a part of the reason why I pursued this was knowing his Parkinson's condition and really trying to figure out more of what is going on in the body. And so, I've started practicing massage with him. It's been powerful, and I'm finding it difficult, however, in the time I spend with him and leading up to getting him on the table, and actually the time spent on the table, finding it difficult to go deeper and to open up more dialogue or even energetic movement around the grief that's involved with this, what's involved with my dad's current experience with moving closer towards the end of life, as well as what I know is some deep-seated grief around what happened in his, like with my parents in their divorce relationship and with his upbringing and father in the war and all that stuff. It's just, so I'm here kind of to, just wondering if anyone here in this discussion has any pieces of wisdom or techniques that I could use to support, or that could be supportive of me opening up the space to share, opening up a grieving space essentially in this process that I'm going through with my family.
Well, I can address that a little bit. I do a lot of work with patients with dementia and advanced dementia. And the first question I usually ask is to the caregivers is, how are they taking care of themselves? And in order to support him, really checking into seeing what are the ways that I'm supporting myself first. And also taking it, whatever you're doing with him, taking it slow, going at a slow pace. And you'll know when you check in with, when your system is more grounded, it'll open you up to feeling more intuitive with him to kind of know where to go, if that makes sense. And so oftentimes when I work with patients with any kind of neurocognitive disorders, it's really working with the family. And if I work directly with the patient, sometimes I'll bring in more creative modalities as well. Music is something that I utilize a lot. And just depending on him, I'd really have to know him and who he is as a person and how he interacts with life and what's meaningful for him to look at where I would go. So.
Yeah, and building on that, Hayden, what Renee just said, depending upon his spiritual orientation, if he has one, or his musical orientation. From a music therapy training background, I oftentimes bring in different types of music, but you have to tailor it specifically to the individual. And then in terms of yourself, Hayden, from a transpersonal perspective, we oftentimes say that the more work we do on ourselves, meaning spiritual work, meditation, contemplation, prayer, yoga, Tai Chi, I would suggest that you do once or twice a day, take 10 to 20 minutes and sit and go into a spiritual self-reflective place, because that builds a certain kind of spiritual strength for yourself as the caregiver, so that then you can bring that to the relationship. And so the more that I work on myself, and before I work with anyone that has grief or loss, before the session is I take 10, 15 minutes and go into meditation or do some yoga stretching on the floor or some Tai Chi moves, just as all for that building of that tissue, that strength of self tissue. And that, then I think you're more prepared to be not only more focused, but to have a certain quality of strength or anchor in the healing dialogue.
I guess, something that's coming up is like I have this shyness around it, and I don't want to cause more discomfort to my dad by touching on things that might relate to grief. Music is fascinating that's coming up because he used to be a musician and played bass guitar until he couldn't control his movements anymore. And I think there's even grief around that. So something there seems really potent and powerful to bring that into it.
Yes, if you could think about what are the genres of music that he used to like to play and that he feels most familiar with listening to. It could be very evocative and comforting to him. And the other suggestion I would have is you could also speak to your own shyness with your father and say, Dad, I really find myself being shy because I don't want to say the wrong thing with you, or I don't know what to say. In the same way that when I sat with that couple, my inner dialogue was, oh my God, what am I going to do? 4 deaths in one night. And one of the things that I said earlier on in the session is, I don't know if I really have a map to assist you, but I'm certainly very open to exploring with all of us of what's going to unfold. So you don't need to be an authority. You don't need to even know the territory. You can allow and trust some unfoldment in that.
Yeah. When you say, I was wondering when you say the shyness around it, is that like not wanting, because it sounds like you were worried when he said he was going into palliative care. Is the shyness around it being afraid to talk with him about what's next, or worried about, the end, how things will be at the end of his life?
Yeah.
Yeah. And I think just naming that, because nobody teaches us how to talk about this. Nobody teaches us how to talk about death. Nobody wants to think about their father not being here, or their, brother not being here. And I think finding a way to name that and utilizing palliative care teams to help with those conversations too can be very powerful.
Yeah. Yeah.
Yeah. And I just saw you take a nice breath.
Yeah.
Yeah.
I have an exercise that it's a meditation that we could do, but again, I'm totally comfortable deferring to other people in the panel if they have a technique or a method or something that they want to teach.
I just want to add real quick to what Anne had just mentioned, because it's really important to know that if he's going to be involved in palliative care, he's going to have a team. And to really know that you're supported and the family's supported in that team, the whole team, the doctors, the nurses, the nurse practitioners, the PAs, the chaplain, and they can all work with you to have that conversation. You're not alone in the process. And so you have a team to support you and your entire family. So I just want to highlight that, because that is available. You don't have to do this yourself.
Thank you. Yeah.
Yeah.
Something that Hayden, it feels like this is a nourishing conversation, and really it's a gift to us that you're sharing what you are. And I love your thought. I love it that it's coming from a person who practices body work as a profession. So I just want to pull out something even more that Ron said and sort of weave something of all these together, and then perhaps take another question or do an exercise. But in the world of grieving and work, there's all this emphasis on self-care. Take care of yourself. Self-care. It's almost like the buzzword we throw out, but really in here, something was different in this conversation that I don't want us to miss, that Ronald said he took those 15 minutes beforehand so that his tissues were different when he was walking in the room with someone else. Like, it isn't just, get a good night's sleep so that you feel good and you can handle how difficult the situation is, but really knowing that your body is in the space with the other bodies in your family, and that there is very subtle communication that's happening below the verbal level. And so the more you as a bodywork professional get your own extra body work, really support your whole frame. Remember in massage school how you had to get them almost every day? Remember that? Like, it's just touching into, wow, this is what I'm doing for my education. I'm getting massages every day so I can learn how to be a help for others. Like, just really getting anything that's extra nourishing for your physiology will carry into the spaces what I think these somatic, folks are highlighting. And so I want to take the opportunity to say that Somatic Experiencing International wants to really acknowledge that some of you are here because you just saw grief and loss, but also because you may be familiar somewhat with somatic experience or curious. And so if, as a result of being here, you'd like to take our basics training, which is a 3-hour class, it's taught live almost every month. We want to just thank you for your presence and acknowledge who you are in the world by giving you a free access to that. So if you'd like that, please email us at publichealth@traumahealing.org. Each person can get like a one-time use code. So you want to, when you sign up, make sure you go to that one. And that may be just another layer of some more support for you to learn about somatic experiencing and the body and the whole neuroscience behind.
Yeah, thank you.
What's here, yeah. So thank you. Does that give you a little something to work with? There's some responses to you in the chat.
Yeah, thank you. Thanks for putting this together and timing.
Awesome. Thank you.
I do have a question for everybody. What the SC work has done for me, it helped me create a lot more space to be with the hard or the painful or the just the bigger energy, because there's a lot that went on at the morgue with families, and I was able to just keep myself steady and make lots of space for something to happen. So I'd be curious how you guys do that in your workplaces, and also, just how do you steady yourself when it's all kinds of things going on and you've got other people involved and other professionals, and someone's talking way too fast and they're going into, like, how do you manage that as someone who has this training?
Well, I monitor my breathing throughout every session, from beginning, middle to end. And I also practice mindfulness meditation on the cushion, but I also practice it in action. And so I'm trying to be really mindful of, am I holding my breath? Am I shallow breathing? Do I need a deep breath? Just in the beginning of this panel, you were so transparent, Jen. I really appreciated you said, I'm really anxious. And prior to getting on to the panel, I felt a little bit of anxiety also. And so I took some time and I meditated. So I think if you can tailor some specific spiritual practice or discipline for yourself as a care provider, it will go a long way to help to facilitate more self-nourishment as well as nourishment in the dyadic relationship.
Yeah, I would like to work with anchors, like wherever I am in an environment, I look, okay, where are my anchors? Whether it's internal breath or external, is there a picture in the room that catches my eye that I really like to look at, so that I can return there and let my eyes rest there for a moment before I continue on. Or sometimes if that doesn't help, because I try to use these strategies when I'm actually with a family. So I don't want to, trying to do it more subtly where I can work with my own breath or find my attention. Or sometimes if the story is too intense, then I know it's probably too intense for them. And then I might say, I really want to hear what you have to say, but it's okay if we both just take a minute, because what you're saying is really really, really deep stuff. And then they usually will take a breath. So sometimes if it's in the moment, I work with where the person is that I'm working with. So we're a team, and how do we both work together to help settle our own systems? If it's between patients, sometimes I'll look around and do the 5 things you see, 4 things you hear, 3 things you sense, taste, smell, just to get my system to just return to the present moment. So those are some things that I do. I don't know, how about you, Anne?
Yeah, I think sometimes in the busyness of, the moment, I try to do that where I just like notice my feet on the floor. Like that's a grounding. If I'm sitting in a family meeting that I know is going to be intense, and there may not be time for that, meditation, or I'm not, within my environment of my own home, I'll try to find something in the room that calms me, whether it's a picture that's on the wall, or even sometimes it's something that, another family member brings into that space, that will help ground me in those moments. And then if it becomes too activating, where maybe somebody's talking too loud, or they're giving a lot of information, and I can sense the family's becoming overstimulated, and myself then will also be overstimulated. I try to ask for a moment. Oh, I'm wondering, that was a lot of information. I'm wondering if, can we, I might put my hand up, or can we just take a minute? Or if I'm close enough, I may touch the person and say, I can see that that's a lot of information, or I can see that seems really devastating to hear, or that was a surprise to hear, as a way then to get maybe just a little silence in the room that will allow for some breathing. I'd be curious, Jen, in those like moments at the morgue when there was that, I imagine, a lot of intense grief, how did you ground yourself, or allow family to have some space?
This would happen once in a while, where someone was there to identify a partner or spouse that they've been with a long time. And you could just feel how it was just devastating. And they've been together so long. And, other people, you might see other people in the room, like not sure what to do, because how are they going to go on? They've been with the person 50 years, that kind of thing, or however long.
Yeah.
And sometimes I might ask the question, well, how did you meet?
Yeah.
And it's amazing what would happen.
Yeah.
Person would light up, and then the family would be like, I didn't know that. And all of a sudden, everybody's kind of involved. And with this thing has happened in the room where it's now just not the person, it's this thing, and it makes me think about the counter vortex. Like we can do something hard if we have this too. So anyway, that's one thing I would do. Sometimes I just sit my butt in the chair and just, no, this is hard. This is just hard. This is just hard. And yeah. So.
Rich discussion. I wish we could have you guys for like 3 more hours. Time is going very quickly, despite the beautiful holding of the slowness and sweetness here. What's happening, what I'd love the 4 of you to know is that questions are showing up that are anonymous. So people are not wanting to come on screen, but they have some curiosity. So continue your discussion as you will, but I want you to have some view on what our folks are curious about. There's a couple of questions in there asking for gems or nuggets of wisdom to medical professionals or first responders. So I think what I'm hearing in that is that they're naming people who are dealing with, high crisis incidents, loss of life, and grief a lot. I think you're getting a lot. It's really helpful for that. But also this other one I want to read specifically because I think it works inside that too. It says, can you comment about the survivor's grief and loss following a violent or unexpected death of a loved one? So they're specifically speaking to, is there a shock trauma component that might need to be addressed? Something like a death in hospice versus something in hospice that one had time to prepare for. So they're talking about not having time to prepare. What do you do then?
Well, I've had this happen several times in the hospital when you have an unexpected death. It's most challenging when it involves the child being the one who's grieving, and it's a parent who dies suddenly, that unexpected death that no one expected would happen around specifically a surgery that was supposed to be successful, that was not. And I think for me, what I do and what the staff around me and the nurses were doing was just to provide a space, just sit with the person, kind of check in with them, use touch if it's appropriate, let them know you're there, provide comfort. I'm here with you. If there's anything that is happening in the body, and I think for kids and adults, there tends to be like a shaking that can sometimes go on. And for me, I just encourage that. It's okay, let the shaking happen. Whatever comes up, just let that happen. Don't engage them in many questions that's going to have them have to try to answer you. But just whatever, if they ask a question, then answer it to the best you can. But that's just being there is the biggest thing. So there was one case where I had a young girl, she was 8, and her mother died suddenly, and the father had to deal with stuff. And so me and another nurse met with her, and one of us got on each side of her and just provided this safe container for her to just breathe and cry, and whatever came out. And, just reassured her, and then made sure there was another family member on the way. We had someone else make sure there was another family member on the way so that they could come be with her. So.
In addition to that, I think it's really useful to pay attention to phenomenology and language, and to just work with, in the phenomenological exchange, the obvious is to sometimes verbalize, you must be in shock, or this must be so shocking to you, or I can't imagine how much pain you're in right now. Something that can help to label the state of mind-body experience that the person's having. Because when you're working with a mother or a father in the emergency room, and they've just been told that their 11-year-old child was run over on her bicycle on the way home, it's beyond shocking. And so I think it's important to kind of assess and address from both the phenomenological perspective, but also from the SE perspective, is that sometimes I might even suggest, Peter has taught us this method of putting left hand under the right armpit and the right hand under the left, which is, calls it the emergency repair tool, is to just be present with the person, maybe make a suggestion like that to attend to the enormity. This must be so enormously overwhelming for you. And I oftentimes put my hand on my heart chakra to make that and communicate that at a nonverbal level. What other folks do?
Well, I have kind of often thought we see these traumatic events that happen in the hospital. So whether that's being with somebody in the ER, or I work in a trauma center, so maybe somebody dies after a gunshot wound. What are like I try to think of, are there any sort of SEs like techniques in those moments? Because the trauma has happened that can stabilize. So when, that family member shows up in your office for therapy, Jen, or, a couple of months later, that's what I often wonder, because I don't know, Renee, if this is your experience, we sort of see the image of you being there with this 8-year-old girl. I always wonder then, well, where's that 8-year-old girl now? And I often think of so many of like the grieving children I've sat with, or the mothers, and like, how are they now years later, after this traumatic death? I'm wondering sort of what are those techniques we can use in the acute care setting before they, hopefully get into bereavement, counseling.
Time is shortly among us. There are a couple of other questions from people, specifically Jennifer and Anne Marie. If either one of you would be willing to ask your question on screen, knowing that time is short. So isn't that an interesting metaphor for all of us, right? Anne Marie, you've got there first. I'm going to bring Anne Marie on screen to ask her question for y'all, okay?
Okay, hi everyone. Thank you for this. I am a current SC student in my advanced year. I also work as a hospice chaplain and grief counselor in Wisconsin. And as I've been going through somatic experiencing training and reading more and more books just about somatics in general, and putting it together with what I experience here in hospice. And I work in an inpatient facility where patients are often at the very end stages of life. I also work some with palliative care patients a little bit, but mostly my question pertains to folks who are pretty close to end of life, where maybe a prognosis is days to weeks or even hours. And I'm curious, for those of you who are in this field, where you've also had direct experience with people in these stages, if there are different themes you see arising somatically or at the level of the nervous system that you see through an SE lens. The medical system has one way of understanding some of what we see coming up for people at the end of life, but I'm curious for other folks trained in SE or other embodiment practices, how you understand some of those common responses like anxiety and restlessness. Those are the ones that are just jumping to my mind right now, but not limited to that. So yeah, just how you put together what you know of SC, what you know of the nervous system, what you know of somatics and people at end of life. So thank you.
So I know for me personally, I see, and our team sees a lot of what we would call it, the medical term, we would call it delirium, right? But a lot of seeing things that we don't see, right? I can't say they're not there. I can just say I don't see them. And so they talk to family members that have already passed. So I've seen a lot of people go through that, or I need to get out of here. Again, I got to get out of here. I don't want to be in this body anymore. If they're in a bed, they might sit up at the edge of the bed and I need to go. I need to go now. So I see that a lot. Sometimes if patients this is where it's great to work with a team of medical providers that can actually keep people comfortable if these symptoms are disturbing to them. So, sometimes they're not, and we always check in. Is that upsetting to you? I mean, sometimes it's upsetting to the people around them, but it's not upsetting to them. No, I'm fine seeing all these things. So we see a lot of that. It varies. Some people like to be touched at end of life, that I've noticed, and some people don't want people touching them. So I know that's something that comes up. Just the touching the skin can be more disruptive to some people, and sometimes it can be comforting. So I think it depends on the individual and just sensing into where they are. I just educate the family if they say, oh, he doesn't seem like he wants to be touched right now. Yeah, sometimes that's hard, and this is normal. And when sometimes people making their transition, they may not want that touch. And here's some other ways you can connect to them. So from a somatic standpoint, somatic doesn't just include, it's the way the body experiences things. right? Whether it's in metaphor, and I see a lot of people using metaphor and to describe things. So if, which is more comforting for them. Yeah.
A couple days before my mom died, a day and a half before she died, she started talking about wanting to get on the boat and what boat to get on and who's going to drive the boat, and she's got to get tickets for the boat. And I thought, that's nice. She's just out of it, you know. And then a day after she died, a colleague at the Wendt Center for Loss and Healing gave me a book called Final Gifts, and it's written by a couple hospice nurses. And I read a paragraph. I thought, oh, that's what she was talking about. And they talk about the soul's leaving, and it needs a vehicle or something like that. It's going to go on a trip. And I was like, oh, she took a boat. Who knew? Anyway, it's really comforting, actually. Like, oh, that's what was happening. She wasn't in distress, but she was getting ready to go. So,
But it's interesting because I think, Renee, you pointed out how then we often are like saying that's delirium, that's delirium. And you know, we want to medicalize that. And sometimes I know that there is really delirium, but I think we're quick to medicalize what is not. We're quick to medicalize death.
The Theravada Buddhist meditation approach, which is to pay attention to thinking, feeling, sensing, smelling, tasting, hearing, is the quality of noting and labeling. And so I think it's sometimes very useful, Henri, if you can co-interact and help to label what state of consciousness and what state of physiological or somatic experience are they in their nervous system. Are they feeling anxiety? Is it fear? Is it hopelessness? Is it helplessness? And is it hopefulness? Many people who are dying, particularly cancer patients I've sat with, are in tremendous pain, even with the use of some hospice drugs, because some people I've worked with, they want to use the opportunity of the dying experience without the medication, and to kind of, if you will, work with the consciousness process of dying in a very conscious way. And so I think if you can pinpoint state of consciousness and state of bodily experience, and then come in with simple and effective interventions like, well, how would you like to work with your breathing to bring down that anxiety? How would you like to work with your nervous system around the experience of feeling helpless or out of control? Is to really pay attention to where they are and to track where they are in their nervous system, as well as where they are in their mind state.
And sometimes I'll do guided meditations with patients that don't really feel comfortable in their body, where we look at a meditation that really has them explore the edges of the body and then move out from there, move out from the edges of the body into the room, and then out from the room into just this expansive place. You know, we've even gone up, you know, to the moon and looking down, and then out to the universe. So it's a way. I did that with a friend of mine when she was in the dying process, and we did a meditation every night for the last month of her life. And she said that was the thing that brought her the most peace, and being able to feel like she could die from in a feeling that's really deep peace within her, because of the meditations that we did that allowed her to actually leave her body before she left her body.
And building on what Jen said about metaphors in the boat, a very common metaphor is to either ask the patient or to wait till they tell you to open up all the doors and all the windows. And as soon as they tell you that's the beginning of the final exit and transition. Sometimes I'll just say, is it time for us to open up all the windows and open the doors so you can take flight? And oftentimes it's very comforting to the being, because they have an experience that you're really with them at where they are.
I love these. Thank you.
Very beautiful, Marie. We are at time, so thank you for being a student, asking that very great question. And thank you everyone for jumping in there. It was, yeah, every one of your responses has been so profound. There's nothing about this subject that isn't. I'm really struck by that more and more by who you are, where you stand with people. Thank you so much for the work you do. We need to really acknowledge you for that, and acknowledge you for the gift you've chosen to be with us in this conversation today. Little hearts are popping up from the other side. Oh my gosh, all these metaphors coming out of my mouth. Usually it's just my foot and my mouth in this session. Now it's just weird metaphors. I don't understand. Oh, look at 1 million little hearts are popping up. I've never seen that before. Literally every time we've done that, I've never seen that. We do need to end pretty promptly on time. There's some other things that need to happen, I know, in some of your worlds today. So want to really support that. So in a pithy nutshell, 30 seconds to 60. How about that for a pressure? I hate that. That always makes massive pressure for me. If there's a resource or something you'd like to say in closing for this group, how might you close us out so we can end at the bottom of the hour?
Well, I just would like to encourage everyone listening to spend time exploring the cultivation and developing of some daily spiritual somatic practice, so that you are in touch with your own instrument, and then you can be more finely attuned in the assisting of the other being.
The phrase that's coming to mind is just welcome to the tribe. Come join us, whoever you are.
So I was just going to offer this, something I do with patients and family members at the end of our sessions sometimes, and just to show that this is pretty heavy stuff, and it's okay to laugh in the midst of it. And so I just want to invite all of you, if you're up for it, and you can watch the rest of us if you're not. So in leading you in a laughter yoga salutation. So if you place your palms together in front of the heart, and we're just going to say goodbye with a laugh. And we can do it 3 times. So we would bow to each other as we laugh. So
That's already.
and just resonate, and just see where that laughter goes.
And I would suggest that for your own self, and when you're sitting, is to go into a meditation and to repeat the phrase, I am loving awareness, you are loving awareness. I am pure, pristine consciousness, you as a being, a pure, pristine consciousness. And may your journey be filled with light and love and healing and compassion.
And let's hear your words in addition to all of these.
Well, I share with Renee in the laughter, and trying to find those moments in real intensity. And I think just reflecting on ways to also be able to laugh, and to laugh at yourself, because can just be so therapeutic.
Life is mightily significant and rapid, isn't it?
Yeah.
Beautiful. Thank you, everyone. We acknowledge you. We acknowledge every one of the guests for joining us today. We had more than 100 people sign up for this. We know this will live on and some legacy online. And so I just thank you for the gift of it. Everyone else who participated, there's questions in the Q&A about crisis and stabilization. If you're not on the SE mailing list, I want to encourage you to get on it. Renee is one of the amazing people on the Crisis Stabilization and Safety Work Group, a program coming out from SEI in October that really can support some short protocols. We were talking about medical and first responders, a lot of these questions in there. I think you'll find some resources in that program, so stay tuned. Please join us next month for our community conversations, and feel free to write to publichealth@traumahealing.org If you'd like to be a speaker or have other ideas or any feedback for us about how this is for you, we love to hear from you and be connected to you. And we get in this moment that we are intimately connected in this conversation. Thanks, Renee, Jen, Ron, and thank you so much. Everybody, have a blessed and wonderful rest of your day.